everybody. This is Dr. Charlene Smith. I'm TV producer and host for Set It Off Senior Style on the African American Network. I am also an author of Senior Seeking Soulmate. I am the TV producer and host of the show, and I'm also a dating and relationship coach. But everything on Set It Off Senior Style is about issues that are related to being a senior citizen, pretty much anybody that's over 50. So today on the African American Network, it's the local network with a local feel, but with a global reach. So we are going to be talking about seniors and Medicare. And today we are blessed to have Mrs. Jaqueline Renteria. She is an agent for Medicare. I contacted her because I had done the Medicare for a couple of times and I wanted a new policy. And I also wasn't really sure what I even had. But she was excellent. She explained everything to me, got me a great policy that includes over-the-counter purchases. I get so much per each month. I am able to have my prescriptions delivered through the mail, and just a lot of really good in-network, out-of-network. She explained all those things. So I was able to come up with a really good plan for me. So she's very knowledgeable. She's a retired educator, and she is doing insurance in her second chapter of life. And she's been doing that for about 4 years now. And I'm telling you, she's excellent. So she's going to tell us about Medicare today and some of the things that you might want to know as a senior. Some of you might not quite be there yet just to get Medicare yet, but it doesn't hurt to know ahead of time so you can do your planning. So, Jaqueline, I'm going to let you tell us a little bit about your background. And then if you would start by explaining what is Medicare.
Mm-hmm. Absolutely. Thank you, Dr. Smith, for that wonderful introduction. And she pretty much said it all. I've been practicing I've been a licensed agent for about 4 years. And I'm just really excited to be able to share this information about Medicare because I know that there is a lot of confusion out there. So I'm hoping that I'll be able to add some nuggets for you to glean off and just learn what is expected of Medicare.
Okay, great. Great. So tell us what is Medicare?
Okay, so Medicare is it's federal health insurance, and it's for those who turn 65. It's also for those that are younger than 65 if they have a disability or they've been on disability, Social Security disability for 24 months. And also it's for those who have end-stage renal disease, which is kidney disease.
Oh, see, I didn't know that. I thought it was strictly for people over 65. So if someone has a disability or a kidney, they would be able to get assistance from Medicare, which you said
Absolutely.
is a federal program. So those are the ones that would be eligible. So now one of the things that I was confused about is there's all these different parts to Medicare, like A, B, and all that. Can you explain what those different parts are?
Absolutely. And I just wanted to add before we move on in terms of those disabilities that once again, they have to be on Social Security disability for 24 months. And also typically they're automatically enrolled. So they're automatically enrolled with end-stage renal disease and they're automatically enrolled in disability. Normally you will get a welcome to Medicare package about 3 months prior. And if you have not received that package and you've been on disability for 24 months through the Social Security, then you need to contact them. And it may be that you have moved or something that it didn't get to you, but it has a really good information that you definitely want to read. So I would encourage you to do that or contact Medicare. It's 1-800-Medicare. So the number is very easy. But just to begin talking about the different parts, I know it gets a little bit confusing, but there are 4 main parts. There's Part A, which is hospital insurance, Part B, which is medical insurance, Part C, which is Medicare Advantage, and Part D, which is prescription drugs. And so I just want to take a little minute, take some time to explain those parts in some detail here. So let's start with Parts A. Parts A and B, they're both what we call original Medicare. Part
Mm.
A is your hospital insurance. So that covers things like skilled nursing facilities, hospice. It also covers home health care. And there is no premium for Part A, because if you're eligible for Part A, that means that you have paid through those 40 work quarters. So there is no premium for Part A. Now, Part B is medical insurance, and that insurance through healthcare providers, that's insurance through doctors. It includes medical, dual medical equipment, home health care, outpatient care, and also some preventative services, screenings and shots and annual wellness exams. But Part B, there is a premium for Part B. And as of January 2024, that premium is $174.40. Now, that is based on what we call an IRMA, which is an income related monthly adjustment amount. And so what they do is they look at what you made 2 years prior to your retirement. So the 174.40 is applicable to your 2022 earnings, since we're now in 2024. And if your income changes, you can request for that to be readjusted.
Okay, that's interesting. That's good.
Yeah. So the original Medicare, like I said, it's Part A and Part B. One of the things that you have to be mindful of, it covers everything. It covers your doctor and your hospitals within the United States. There is no referral required, and your out-of-pocket cost is usually around 20% in terms of co-insurance. It does not cover foreign travel. And one thing that a lot of people are not aware of is there is no yearly limit to the amount of out-of-pocket that you have if you do not have a supplemental coverage. So Medicare Part A and Part B is not enough alone. So you would need to add a supplemental coverage.
Okay, so is that like getting another insurance company, medical, like Blue Shield, Blue Cross, mail handlers,
Yes. So I
Aetna,
will
all of those? Okay.
absolutely, absolutely. So what are the things that you can add to original Medicare? You've got Part A and Part B. You do need to add a prescription drug plan. Okay, you do need to add a prescription drug plan. That is required. If you do not add a prescription drug plan, then you may be subject to a Part D penalty for as long as you have that prescription drug plan. So keep that in mind. And you have to have what we call credible coverage. Credible coverage means that it is covered by a private insurer, because those private insurers, they have to follow Medicare set rules. So you do need to make sure that you have credible coverage. That's what they're going to be looking for. And so that's Part D. And so in terms of the coverage that you just mentioned, you said, okay, so what other coverage do I need if original Medicare is not enough? And that's Part A and Part B. Well, you can look at two sides. You can go with the supplemental coverage, which is called Medigap. And what that does is it covers the gaps that original Medicare does not cover. Or you can go with Part C, which is Medicare Advantage. And so Medicare Advantage, which is what you have, it covers all medical and necessary services that original Medicare doesn't cover. It includes dental, vision, and hearing. It does not cover things that are outside of the United States. That depends. They have some plans, but very limited amount. But most of the time it includes that Part D, which a lot of people, as I mentioned previously, that's something that you will need. So keep that in mind.
Okay, great. So, so when should a person sign up for Medicare? Because I know there's a certain time you have to sign up, whether you get all of it or not. But when do you have to do that? Because like I worked until I was 67, and I was working federal service, so they covered my medical and all of that, but I still had to sign up for Medicare. So what is the age you have to do all that?
Okay. Well, you just brought up a very good point. And the question is, should I sign up? We'll start with, should I sign up for Medicare?
Okay.
And so if you are uninsured, or you have individual coverage, then, and you're 65, you should sign up for Medicare. If you have COBRA or retiree coverage, you should sign up for Medicare. If you have worked for an employer with 20 or less employees, then you need to sign up for Medicare Parts A and B, and do a comparison of that secondary coverage. If you work for an employer that has more than 20 employees, now the number 20 is the magic number, then maybe that's when you want to consider waiting to sign up, remain with that insurance until you either lose coverage, or then you may decide at that time, I want to do a cost comparison. I'm ready to go ahead on up and sign up for Medicare. So a lot of people get confused as to when should I sign up and should I sign up? So the next question is when you should sign up. So there are several periods. When you're turning 65, that's what we call an individual enrollment period or initial enrollment period. You have 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after that. Okay, so you have a 7-month window. The plan effective date is the first date of the month of your birthday. Okay, and if you do not sign up within that window, then you may face a penalty as long as you have Part B. So it is very, very important to sign up at that time and look at all these different scenarios, because they're going to be different for different people. 65 looks a lot different than it was. A lot of people that are 65, we're doing, they're doing a lot of different things. Yeah, that's something to think about. And then another time is when we call annual enrollment period. That happens October 15th through December 7th. Now that's when you can switch and drop your Medicare Advantage plans. So, and if you want to add a drug plan at that time. But that gives you October 15th through December 7th, and the plan effective date is January 1. Okay. Another enrollment time is what we call open enrollment. So from January 1st to March 31st, if you have a Medicare Advantage plan that you want to change to a different plan, then you have that period to do that. Or you can switch to original Medicare or join a separate drug plan. And the plan effective date is the first of each month. So if you sign up in January, your plan effective date will be February 1st, and so on and so forth. And another enrollment period is what we call special enrollments, and that's throughout the year. This allows you to make those changes throughout the year. Let's just say if you have moved, let's say that if there's a situation where there's a disaster in your area, change in service, those type of things, that gives you that special enrollment period. And then going back to what we talked about earlier with your employer, let's just say at this point, you're no longer going to be with your employer insurance and you want to sign up for Medicare now. You passed your 65th birthday. You have an 8-month window to do that from the month after your employment ends. So that's another special election period. So enrollment is all year round, but it just depends on what is specific to your circumstances at that time.
Wow. Okay. So that's a lot. So basically, I think I'm hearing, so like I wanted to change my Advantage plan. And so back in November last year, we talked and I changed it. It became effective the 1st of January. But it sounds like if you get into a plan and you're not sure it's really working for you the way you thought, you have some opportunities to change it.
Absolutely.
Okay, well, that's good
You
to
got
know.
it.
Awesome. Yeah, so many things that are so complicated about this stuff. Okay, so we're in San Antonio, the military city USA. So there's a lot of veterans here. Should a veteran sign up for Medicare, or because like I'm a veteran, but I didn't retire from the military. So what kind of options are out there for the different types of veterans?
Okay, that's a very good question. So if you are a veteran, there are options that are available to you with Medicare Advantage, other benefits that you can receive because you are a veteran. So there are plans specific for veterans. Now, yes, you still have the VA, which a lot of veterans go to the VA, but this just gives you some additional options that are available to you. I can't go into all the specifics, but just so you're aware, you definitely want to talk to a licensed agent regarding what kind of benefits are you missing out on as a veteran. So now, if you are retired, many of the veterans, many of the retirees, they have what they call TRICARE. So when they turn 65, they have TRICARE for life. And so they have to sign up. They are required to sign up for Medicare Parts A and B. So Medicare becomes first, TRICARE becomes second. So they do have to pay that Part B premium. So that's something to think about in a lot. Sometimes the TRICARE beneficiaries are a little bit confused about that, but it's very clear that they have to sign up for A and B. And once again, as a TRICARE beneficiary, there are things that are available for them as well, but you do need to talk to a licensed agent to see how that works for you.
Okay, great. So now, when my mother was staying with me, she passed recently, but she had Medicare and she had TRICARE. And that covered all of her home health, like you said earlier, hospice was covered, all of that. But I've heard people talk about Medicaid, and somebody was telling me, excuse me, that I could get somebody to come and be a companion to my mom and, sit with her and shower and do all of that. Well, the home health care took care of the showering, but I couldn't get the companion and housekeeping and all of that. And somebody said, well, you have to be on Medicaid. So can you explain the differences? Because we weren't able to do that. What is the difference there?
Yeah, it's that a lot of people get that confused. But remember, we said Medicare is federal. Well, Medicaid is federal and state. And it provides health care for coverage for those that are eligible low income. It also provides it for children, pregnant women, disability. So that's what Medicaid is designed to do. And Medicare pays first, and then Medicaid picks up where Medicare doesn't pay.
But that's for people at a certain monthly income level. Okay.
Yes, you have to be eligible for it.
Okay. Yes. So, and you said it's the lower income level. So
yes, and it's state by state. Yeah.
Okay. Great. Well, because I was hearing both of these things and I'm like, okay, but they just said, oh, she won't qualify. They never gave me the details about it, but it's based on your income. So that's good to know. Okay, so as seniors, we always have all these wonderful things. So if you could talk a little bit about some good wellness tips and how to utilize, because I know with my plan, there's a lot of things available. Like I think I've got like some exercise or wellness things I can do. I'm not sure if it's a gym discount or whatever, but there's a lot of other things besides just going to the doctor and taking care of problems associated with it. So could you, give us a few tips about wellness, and then also some of the things that maybe just some of the plans offer that, they might be able to ask for when they're trying to get a new plan?
So you definitely want to ask for those additional benefits. And that's what they're called. They're just additional benefits, additional add-ons to those plans when you do talk to a licensed agent. And they'll be able to go through specifically exactly what's available. It's plan specific. So I can't get into detail, but just as you mentioned, there are some things that include gym membership and all of that. So keep that in mind. And all of that has to do with being healthy. So as far as seniors and healthy living, I think about the 3 B's. So you want to be healthy, you want to be informed, and you definitely want to be connected. So those are the three things, the three B's. And it starts with being healthy. And just like you talked about, those preventative wellness checks, staying active, things like that, that's also very, very important. Even in terms of you're getting your dental visits in, twice a year. Also, eating healthy looks different for every senior. So definitely check with your doctor before you start going into any type of routine, because it looks different for everyone. And of course, you want to avoid tobacco at all costs because it does cause lung disease, all kinds of heart disease. And mental health is a big thing. So there's definitely a lot of resources available to seniors that will assist them in what they need to do, what are some signs, also if they need, places that they can go to get that type of help. Another thing is doing puzzles, doing all kinds of brain activities. Those things help. And also financial being financially healthy. In 2017, it showed that over 50% of Americans have no retirement plan. So you want to speak to a licensed financial advisor to help you navigate through all of the retirement issues. And you talked earlier of even with going to the gym is important, but that also helps you get connected with other people. So it's getting you out of the house, participating in activities, volunteering. All those things are good for your mind, your body, and your soul. Knowing your neighbors is important, having a point of contact so that they'll know if something happens, who do they need to contact. And volunteering for, long-term care facilities, or there's so many opportunities to volunteer. You and I share sorority, so we volunteer. So, there are ways to stay connected, and it's so key with our seniors. And just be informed. I think today's seniors are so savvy with the computer, so they're learning how to go on there and find out different things. Like you're learning about Medicare, you're learning about Medicaid, home health care, assisted living, all those things, housing, what's available on the state level, what's available on the local level, all of those things, and getting counseling for final expenses. I always say good health is the best wealth.
Yes. I like it. I like it. That's great. And I like the three B's. So the be healthy, we talk about health things on the show, getting out, just moving your body, eating as best you can. We all know we like the fatty foods. We really like the soul foods, but finding alternate ways to fix it. Like I've made vegan sweet potato pie and it tastes good, which I was surprised. I've done switching out from the cow milk to like the almond milk, the soy milk.
Yes.
Little changes like that make a difference. And with the African American community, after you reach a certain age, your body doesn't digest the lactose and all that with the cow milk. So a nice alternative is that. So I'm glad you talked about be healthy, the preventative. And, we all talk about diets, but diets don't always work. So I do the 80-20 rule, which is 80% of the time I eat healthy. And then that 20% is like for holidays, if I'm traveling and those things.
Yeah.
So I'm glad you talked about that. And then be informed. I am really impressed that a lot of people in my age group, 70 and older, are on the computer. They're Zooming. And I think because of COVID, they want to talk to the grandbabies. So they learned how to do the Zoom,
Yeah, it created an avenue. Yeah,
Yes.
absolutely.
And using the phones, we've gotten away from the flip phones. Look, my uncle had a flip phone for like years after the other phones were available. But getting, knowing how to do the cell phone and getting on the computer. My mom was 89 when she passed, but she knew how to work her phone. She could do her call her people and all that kind of stuff without, and send pictures and
Mhm.
lots of things like that. So the Be Informed, the Google, she even told me, well, why don't you Google that? And I'm like, well, okay, Mom. You
Okay.
know? And then your Be Connected. That is really important for
Mhm.
seniors. And oh, and
Mhm.
and this is May Mental Health Month, so I'm glad you mentioned
Yes.
that. And part
Mhm.
of good mental health is to be connected.
Yes,
I put something
absolutely.
out on Facebook, just kind of like an informal survey, and I asked, how many hugs have you had this week? And some people said zero. And
Mhm.
my target market are seniors, and so
Mhm.
I was like, okay, well then let's get out, go to church, visit
Mhm.
your family, do something like you
Mhm.
said, volunteer, and get your hugs. But also let people know your routine. You were talking about that. Know your
Mhm.
neighbors, because I have been at home myself where I could be in there for days because I'm an introvert, really, and I can be in my house for days and not have a visitor and not have a phone call, as much as I
Mhm.
get out there. So
Mhm.
this is kind of sad, but one day I was sitting there and I'm like, if I were to die, how long would it take for somebody to know I'm gone? And thinking about that, I'm like, I need to let people know that I am at home alone. And
Mhm.
sometimes people assume because I don't answer the phone, I'm doing something
Mhm.
else. Like my
Mhm.
aunt, she said, well, I called you and you didn't answer, so I figured you were out on a hot date. Well, you know, I might be, but I don't get that many dates right now.
Yeah.
you know, and so it's like, well, check back because, and maybe I'm out, maybe I'm not, maybe I'm laying on the
Mhm.
floor and I need
Mhm.
help. And so, letting people know your routines. And if you do call and somebody doesn't answer, call back because you never
Mhm.
know. People say, well, get that life alert. But the life alert, if you can't talk, like if you're having a stroke or something, you can't talk or you can't get to it, how are you going to use it? So you need to have some
Mhm.
backups to that. So
Yeah.
a lot of seniors live alone. That's why I'm glad you said get connected. There's community centers in where I'm in San Antonio, and there
Mhm.
are community centers all over San Antonio that have
Mhm.
activities to get people involved, and it doesn't cost anything.
No.
So get
Mm-mm.
out,
It
get connected,
don't.
work on your mental health, be informed, and do the prevention, be healthy.
Mhm.
And my thing, I talk about be the partner that you desire. If you want a healthy partner,
Mhm.
you got to be healthy.
Healthy. Yep.
Yep. And so all of this, once you turn 65, getting your Medicare, sometimes I think my social life is going to the doctor all the time. you know, when I was younger, I remember people would say, oh yeah, I got this ailment, I got that ailment, I'm taking
Mhm.
this medication, this doctor said
Mhm.
that, and now here I am. So, but having that Medicare, if you
Mhm.
qualify for the Medicaid,
Mhm.
get that stuff. And if you have a plan that you're not happy with, you do have the ability to change it. There's
Mhm.
a lot of things like the hospice and the home health care that's available. We don't think about that when we're younger.
Mm-mm.
But
No.
the Medicare plans will help you through your senior years, and they can contact, like you, my sister. And so, if you would give us your contact information, it'll be down
Mhm.
on the bottom of the screen also, but give us your contact information so they can call you because I think you're an excellent agent.
Oh, thank you. I appreciate that. So,
Yeah.
you can reach me at my number. It's 210-325-4052. You can
Say,
also, you
say it
can
again.
also, oh, 210
Uh-huh.
325-4052.
Okay.
And, or you can email me. The contact information will be at the bottom of the screen. You can email me as well. So, but yes, call me at 210-325-4052. If I'm not available, leave a message and I will get back with you as soon as I can.
Awesome, awesome. Well, Ms. Jaqueline Renteria, I really appreciate you taking the time out of your busy schedule to talk on this show, Set It Off Senior Style, which is on the African American Network with a local feel and a global reach. We so appreciate your information. It's so important for seniors to know, and even younger people, so they can plan for the
Absolutely.
future. But thank
Hmm.
you so much. Great interview, dear. And I appreciate you sharing that knowledge. So, everyone,
Thank
please
you.
contact her so you can find out about all the plans. And she's very knowledgeable on it. And she can get you straight and get you the plan that gets you the most benefits. So, thank you
Hmm.
very much. Appreciate everybody. This is
Thank
Dr.
you.
Charlene Smith, TV host and TV producer for Set It Off Senior Style. Thank you so much.
Thank you.